This conference will now be recorded.
Dear colleagues, I'm Maureen Ellis, the Executive Director of the International Federation of Biosafety Associations. I'd like to spend the next few minutes with you discussing some important questions surrounding biosafety, biosecurity, and the response to COVID-19. The global community has been urged to join a call for action for a collaborative response in the fight against COVID-19. We know that no one should be left behind and that equitable access to essential technologies is essential. This includes safe and secure diagnostic testing. Our community has been working on the front lines, often behind the scenes, to ensure safe and secure diagnosis for COVID-19. We have a Facebook group to discuss biosafety protocols, share solutions, and learn from each other. I'd like to share some of these questions and answers with you today. Question number 1, what biosafety guidelines should be followed for handling COVID-19 specimens in the laboratory? Well, there are international guidelines and best practices, such as those distributed by the World Health Organization. There are also country-specific guidelines and national requirements that should be followed. In answering this question, I'll touch mainly upon the WHO Biosafety Guidance document for COVID-19. It's important to recognize that the main thrust of this document is that all procedures in the laboratory with COVID-19 need to be performed carefully based on a risk assessment by trained personnel. This new guidance document for COVID-19 follows a risk-based approach, whereby core biosafety requirements for every laboratory are presented. These are supplemented with heightened control measures based on the specific conditions in your laboratory and the specific activities that you're carrying out. This differs from the previous WHO approach, whereby laboratories were classified into various laboratory levels from 1 through 4. In the new approach, this risk-based approach, laboratories are given a set of core requirements and a number of different heightened control measures that can be added on to the core requirements, depending on the activities that they're carrying out and the risks that are presented in their laboratory. Within the Biosafety Guidance document for COVID-19 published by the WHO, you will find recommendations addressing the minimal essential working conditions associated with specific COVID-19 manipulations in the laboratory. In the annex in the document, you'll find a list of the core requirements that all laboratories should be following. Another question that we often get asked is, how should I perform a risk assessment to identify and mitigate specific risks in my laboratory when I'm handling COVID-19 specimens? Again, the WHO Biosafety Guidance document does provide a very detailed risk assessment template that goes through the different steps in carrying out your risk assessment, from gathering information to evaluating the risks, developing a strategy to mitigate those risks, and reviewing your control measures on an ongoing basis to ensure that you're still implementing an appropriate risk-based biosafety and biosecurity program in your laboratory. So I encourage you to look at the templates that are provided by the WHO, go through each of those questions, and you should be able to complete your risk assessment specific for your own laboratory. Do I need to work in a biosafety cabinet to safely handle COVID-19 specimens? Generally speaking, initial processing of specimens before inactivation should be carried out in a biosafety cabinet that is certified, meaning it has been checked and validated to ensure it's working properly. There are other primary containment devices that could also be considered, such as ventilated hoods, should biosafety cabinets not be available. But generally speaking, you should be working in a certified biological safety cabinet. Again, if you're working with organisms at a higher risk level, for example, research activities, virus propagation, you should be working in a biosafety level 3 laboratory and in a biosafety cabinet. Question number 4, can point of care testing be conducted outside of the laboratory area without the use of a biological safety cabinet? Again, this depends on your local risk assessment, but generally speaking, point of care testing and rapid assays can be performed on the bench without employing a biosafety cabinet, providing a number of proper precautions are put into place. The WHO guidance document provides some very good details on what these specific additional precautions that should be put in place when working with these different types of technologies outside of the traditional laboratory environment. So please carefully consult the guidance document and have a look at the following conditions that should be met. You need to perform your work on an absorbent material in a well-ventilated area free of clutter. Ensure that appropriate PPE is worn while conducting these activities. Respiratory protection may also be needed. Staff should be trained in performing good microbiological practices such that aerosols are not created in the manipulation of the specimen. Be sure that staff are not rushed in carrying out their activities and that there is no pressure for increased turnaround times. Again, a validated infectious waste process for any specimens to make sure that they are not left behind is also very important. Question number 5, is there an increased biosecurity threat from someone with malicious intent, either insiders or outsiders, during the COVID-19 pandemic? Outsider threats. These may be opportunistic individuals who want to perhaps steal infectious samples from poorly secured clinical laboratories. The insider threat, with an increased number of individuals with access to these samples during the outbreak setting, we need to also carefully consider the insider threat. Rapidly scaling up of human resources to deal with the increased number of samples also presents a greater insider threat. Perhaps we are focusing more on diagnostic capability rather than necessary background checks for all of the scaled up human resources that are now working with our specimens. The likelihood of such an event, an insider or outsider threat, may be low, but it's one that we cannot ignore. So what biosecurity measures could be put in place to prevent the virus from getting into the wrong hands? First and foremost, we need to balance the need for effective biosecurity without overemphasizing the threat. We need to consider the complexity of the response on the front lines. Our frontline healthcare workers and teams are already struggling to ensure that appropriate infection control and biosafety practices are in place. We don't want to create any additional unnecessary burdens that might increase their risk. And therefore, we want to implement biosecurity measures that are already within their day-to-day practices and protocols for infection control and biosafety. For example, there are some simple things that we can do to increase biosecurity awareness among frontline workers working with pathogens. It's important that they understand that the outbreak creates circumstances in which individuals with malicious intent may have increased access to the virus. We need to encourage them to report suspicious behavior around patient centers and laboratories. And of course, restricting access to these patient centers and laboratories is essential as well. When dealing with samples, we want to make sure that we move samples from the field, from the collection centers to the laboratories as soon as possible, and that there is a chain of custody sign-off. We need to know who we are handing the samples off to and verify that this is a legitimate transfer of the samples to the laboratory. We want to ensure that there are no orphan samples, no samples left behind, or long-term storage of samples after the outbreak is over. It's critically important that all unwanted or unused samples for research that are no longer needed, for example, all of these samples should be appropriately decontaminated and disposed of, such that they're not left behind following the outbreak. So some closing thoughts for you. Response to the COVID-19 pandemic will require a coordinated, collaborative, global approach with multidisciplinary teams of clinicians, epidemiologists, doctors, nurses, logistics technicians, but also biosafety and biosecurity professionals. They are a key part of the response. So what can we do as biosafety and biosecurity professionals to contribute to our global collaboration in responding to the pandemic? First and foremost, we want to be critical thinkers and focus on applying the knowledge that we have to develop our risk-based, practical, and sustainable solutions for biosafety and biosecurity that can be implemented in each of our laboratory facilities. We want to provide our expertise, our guidance, our support to our national authorities in developing their national biosafety and biosecurity plans. And lastly, please contribute your experiences, your knowledge, your expertise to others around the globe through the IFBA COVID-19 Biosafety Facebook group or other mechanisms and networks. We need to continue to learn from each other and to share our responses, share our knowledge in order to be able to tackle and fight this current pandemic against COVID-19. I thank you very much, and we wish you a safe and secure work with your biological materials and in handling the response to COVID-19.